Hello everyone, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member, and it was with great honor that I was accepted to present at American Public Health Association 2024. This was one that was really interesting because there were three components that was going on: chronic obstructive pulmonary disease, Alzheimer's disease, and poverty. Very relevant for public health. So let's go ahead and get started. So the name of this presentation was Association between Poverty Status and Alzheimer's Disease-Related Mortality Among Older Patients with COPD. And we actually, there was three organizations that came together to collaborate and present. Second author was Dr. Bobby Johnson, Sarah Krausen, and then Dr. Rhonda McIntyre, Arturo Olazabal, and then Dr. Jagdish Gupchandani. This comprised of my collaborators, current students, former students, and all of us kind of worked together to put this together. So what we went over is the introduction, methods, results, and connection to geospatial findings. I'm not going to go over too much detail from the abstract because I'm going to be going over this within the presentation. So for starters, physical health, of course, is intertwined with public health, social determinants of health. That's very crucial to understand and has been established many times. 1 in 5 people ages 65 and older, that translates to 11%, has Alzheimer's disease, and then 14.2 million people has COPD as of 2021. So that's a lot of people with COPD, a lot of people with Alzheimer's disease. And then 2023, the official poverty rate in the United States was 11.1%. And that means that 36.8 million people. There's about over 300 million currently. And so that's quite a bit of people that are impoverished. And of course, the wealth gap just increases when there's certain regulations and deregulation. There was a slight decrease from the previous year on the poverty level, but regardless, as I said from the very beginning, Alzheimer's disease, poverty, and chronic obstructive pulmonary disease are all intertwined here. One is chronic disease of the lung, one is chronic disease of the brain. And so there's a connection there. There's always connections between two organs, and of course poverty kind of is part of this as well. So the connection between two organs is something that I have actually established in multiple places. My dissertation was on connecting the cardiovascular system to chronic kidney disease, and it's known as chronic cardiorenal syndrome. So that's an aside. But chronic obstructive pulmonary disease is the third leading cause of death worldwide, with 3.2 million people dying in 2019. So between 2011 to 2021, prevalence of COPD actually remained stable, but the prevalence increased at a higher age in rural areas and in those who had smoked. And smoking is self-evident, but rural areas, that is another sign of access and disparities in access. Let's go to Alzheimer's disease. This is a neurological disease leading to brain cell death, which causes cognitive decline, memory loss, and behavior changes. This affects around 60 million people worldwide with dementia, and of course is going to be tripling by 2050, and that's a staggering and alarming statistic. Rubin and colleagues at Duke University actually found that from medical records, about 1.4 million individuals were searching for medical records in here, and were able to analyze using that. And so biological science this is interesting. Biological science for neighborhood-associated neurodegeneration can seen earlier in adulthood, long before people would show up in clinics. So based on where you're living, that actually predicts neurodegeneration. What are some additional findings? Smaller scale studies of people in the United States and England found that the most disadvantaged areas, 43% increased risk of developing dementia. There was also poor neighborhoods at physically older brain at 45 when the researchers looked at the MRI scans. And this was very interesting. And also they scored worse on memory tests. Now poverty, just the final measure. So social poverty measure, that was 11.2 0.1% of people living in poverty in 2023. Very significant social determinants of health that affect neurological diseases. So people in low-income areas, not only are they experiencing higher levels of cognitive decline, but they're also experiencing higher levels of stroke, higher levels of epilepsy, and that relates to neighborhood poverty. And you can obviously see brain structures and poor cognitive outcomes. So this is the connection between Alzheimer's disease and poverty. The longer an individual lives in poverty, the lower the cognitive score. So how do we connect all of this? And one of my previous students actually took on this difficult task, and I asked her if she was up for this. And so about 99% of the patients who survived COVID-19 have reported not only neurological defects, but also cognitive. So not only neighborhood, but also the disease transmission leads to this. And COVID-19, of course, disproportionately affected the poor living in densely populated areas, and that would allow for COVID-19 to spread and provide the perfect storm for increasing cognitive decline. Respiratory disease is, of course, the main cause of death. In 45% of the individuals experiencing dementia. And what happens really at the end is that they even forget to swallow, and so a lot of them are actually gagging in the saliva that is being produced. Perhaps, and this is something that we see often, inflammation is connected to poverty, COPD, and Alzheimer's disease. The allostatic load from higher stress can also increase chronic diseases. And of course, smoking is something that is a common denominator between these different diseases. I wanted to visit this paper where we talk about, this is a previous paper, talk about the common denominator being inflammation. This was actually published just this year, and really went into how C-reactive protein and mortality risk was actually increased among COPD patients. So the methods we actually looked at and followed people from 1999 to 2010 into December 31, 2019. These individuals were actually 65 years and older among adults with COPD, and I'm going to compare that to people without COPD. COPD was determined by self-reported data. PIR was actually determined with some numerical measures. ADRD mortality, these were the ICD-10 codes. When they have these underlying causes of death, this is how you determine this. Here were the confounders: age, gender, education, ethnicity, standard. And then complex samples Cox regression was used here. So just quickly looking at this, older adults with COPD, you see 5.41 times suffering mortality with a statistically significant, and this is hazard ratio, so we used, as I said, Cox regression. So let's compare this to the next slide where we're only looking at 1.13. This is not even statistically significant, so people that don't have COPD and just experience poverty, they don't necessarily increase likelihood of Alzheimer's disease-related mortality. However, when you combine both poverty and COPD, there's increased likelihood of mortality, showing the importance of determining poverty for individuals that are suffering through chronic diseases. So, interpretation, we found that poverty is connected to ADRD mortality, but not only that, we found that people with COPD are more likely to experience ADRD mortality than those without COPD, and the relationship remains strong even after controlling for confounders. This is looking at COPD cognitive decline, and these are areas that I've circled that have experienced increased COPD and cognitive decline. Seems like Georgia does not have as much as some of the different maps, even Texas, but the Appalachians, some of the southern regions actually experiencing, and then New York City, and I wonder if that's due to poverty and geospatial connections to that. This is using places data. This is CDC level data, and this is looking at health insurance versus cognitive decline. Health insurance being a proxy for showing poverty. So poverty versus cognitive decline. There are pockets where there's a strong relationship. In Texas, such a big state, there's actually multiple areas that the relationship is stronger. So all of these dark areas, there's strong relationships. So what is important is to go at a more granular level, zone in zoom in on some of these areas and see what are some of the metropolitan areas that might be experiencing this further. So in summary, this is a map that shows a geographic relationship between cognitive decline that is proxy for Alzheimer's disease. We also created a map that demonstrates poverty and cognitive decline, and Appalachia southern regions were most affected, and southern regions had the most significant relationship. The main conclusions are the study highlights the importance of addressing poverty in populations at risk and reducing mortality. This is related to ADRD and COPD. So screening and targeting socioeconomic factors, screening for social determinants of health in every visit is especially important when you have people with chronic diseases, older population individuals. What are the key takeaways? Well, the major ones is that there is a strong connection between poverty and Alzheimer's disease-related mortality. We saw the geospatial connection with uneven distribution, but certain areas having stronger connections than others. Again, future research should show and investigate health equity and social determinants of health. Screening should include assessment of social determinants, and policy should be considered to integrate, and this can be done by incorporating Healthy People 2030, and that is about 359 objectives. I actually appealed to the government to include and increase the number of objectives when they were taking comments, and so a lot of these areas are important. Here are the selected references. I hope you've learned something from this presentation. Thank you for listening.